everyone. Welcome to the Concussion Discussions series brought to you by Integrated Brain Centers. I am your host, Amy Zellmer from Faces of TBI, and I'm here today with Dr. Glen Zielinski from Northwest Functional Neurology, and we're going to be talking about TBI and PTSD. So welcome to the series. Happy to have you here.
Hey, Amy, nice to see you again. Great to be here.
It's always a pleasure to chat with you, and I'm excited to have you here today talking about PTSD. I think, it's sort of an overlooked component within TBI, and some of the symptoms mimic each other, and we're just often overlooked. So I'm thrilled to have you here today talking about it. And where would you like to start with this subject?
Oh, that's a really good question. I mean, it's kind of an enormous topic. When you start thinking about PTSD, I mean, PTSD is a function of your brain, right? I mean, people like to look at things from the perspective of this is an emotional issue, this is a traumatic brain injury issue. And the reality is that anything that your brain's capable of generating, whether that be an emotion or a thought or a motor output or whatever, all of those things have got some capacity to be impacted by a traumatic brain injury. So it really kind of doesn't make any sense to separate those things out from those sorts of perspectives. And the unfortunate reality of that is that so many people do that because of a lot of the biases that just sort of exist in healthcare. People think, well, this is a mental condition, and as opposed to this is a real condition. You know what I mean? Like, people have things that they think are about physiology and then things that they think are just about emotional issues and early trauma and so on and so forth. But the reality is that all of these things are based on similar pathways. And a lot of those pathways are very easily damaged. And a lot of those pathways are extremely, extremely sensitive to things like traumatic brain injuries. And it's not at all uncommon that an injury to one of these pathways can lead to everything from a cognitive problem to PTSD to difficulty with attention and focus, to difficulty with memory, and so on and so forth. There's a system in your brain called the hippocampus. And the hippocampus is a very fragile tissue. The hippocampus, so if you look at how memory works, right? Like, there's what most people think about short-term memory inappropriately. Short-term memory is usually what's best conceived of as working memory. Mm-hmm. And working memory is sort of like a function of your frontal lobe. And then short-term memory, you can think of that as, well, if you think of working memory as sort of like the RAM in your computer, like this is how many programs you can run at any point in time. You have to get from your RAM into your hard drive. Your hard drive is short-term memory. Your backup drive is long-term memory. And there's a pathway called the hippocampus that runs in between those. That's kind of like your memory bus. And it's fragile because most of your brain's got 6 or 7 layers, depending on who you talk to. And this has only got 3. And that system is really sensitive to things like shearing forces when you have a rotational hit, and you can screw it up. Now, one of the problems with that is that when people damage that pathway, they start having things like memory difficulties and problems with memory access and so on and so forth. But another thing that system does is regulate stress pathways. It regulates cortisol. So cortisol is basically a big stress chemical. It's a stress hormone, stress neurotransmitter, depending on who you talk to. And the idea is that that's also involved in helping you regulate blood sugar as you go through the day. And if that system gets messed up, your ability to control your stress responses can go out the window. So as your memory starts to go down, your ability to have a normal stress response goes out the window as well. And we see patients that have PTSD and have had PTSD for a while, and you take a look at them on an MRI, and you'll literally see that their hippocampus has gotten physically small. And as that system gets messed up, your ability to regulate things like sleep-wake cycles goes out the window. And anytime you have any kind of a stressor, what's supposed to happen is that your frontal lobe goes and yells into your temporal lobe and says, do I have a context for this piece of information? Do I have something in my memory that can allow me to go, no, this is okay? And if you don't have that, because you can't make that communication, all you wind up with is the stress. So somebody's walking down the street and somebody jumps out in front of them. And that's a stressor, right? And if you've had that happen as like trauma in the past, like you got mugged or something along those lines, it's normal to have a panic attack as a consequence of that. But somebody just walks in front of you, you have the same response if you can't quickly build context for that information. And when your hippocampus gets messed up, it's really difficult for somebody to build context. So what does that translate to? You have an issue with working memory, you have an issue with cognition, you have the same pathways that are setting you up for things like PTSD. and somebody goes, well, let's just put you in therapy, let's put you in counseling, and so on and so forth. And I'm not saying that's inappropriate. I think it's absolutely necessary, but there are therapies that you can engage in to help you rebuild some of those pathways that can help you get this stuff back under control. Because the thing to understand is that this is a dysregulation of some neurologic pathways. There's another thing that's really important to understand about PTSD, and that's that your brain has this series of error correction systems. All right. There's a system called your cingulate cortex. And the cingulate cortex is basically something that decides whether or not you have a pattern going on in the world that matches the intended output. So what am I saying? Imagine you're walking down the street and you step off a curb and you're not expecting that to happen. What happens? What's the first thing? You immediately get like this big blast of stress as your brain goes, I had a pattern that I was expecting to see executed and it didn't work. Something else is wrong. And it fires this big blast of stress as an error correction. Now, imagine that you screw your eyes up, or you screw up the way that your eyes track, or you screw up the way that your inner ear works, so that every time you turn your head, your eyes wind up in the wrong place. Or you get into a situation where your eyes and your inner ear don't match, and they're saying different things about where you are in space, and so on and so forth. That creates problems where every time you move your eyes, you try to move your eyes to one target, they don't get there. Yeah. And what happens when they don't get there? You fire that cingulate cortex system, and the world becomes a very scary place, right? If you can't map out where you are in the world can be terrifying. And that's one of the most common things that we see when somebody has a traumatic brain injury.
Yeah.
I mean, we look at things, so there's a lot of different ways to think about brain function, but the way that I always like to explain this stuff to my patients is you have to think of it in terms of like primary and secondary and tertiary pathways, with every level building on the inputs that it gets from the level below. All right. So if you think, what's the tertiary stuff? This is cognition. This is executive function. This is personality. This is attention focus. This is the level that you live at, right? This is consciousness for all intent and purpose. Drop down a level, you're talking about things that are about like memory and emotional regulation. But the primary pathways, they call them primary because they're primary for survivability, right? Your primary pathways are all about where's the world? Where am I in relation to the world? How do I localize myself in the environment so I can respond to the environment properly? And those pathways are basically inputs from your eyes, inputs from your inner ear, and feedback from muscles and joints, visual, vestibular, and proprioceptive systems. And they all kind of come together and hang out and first start talking to each other in areas of the brain and brainstem that are super sensitive to rotational shearing forces. So what happens when somebody gets a TBI, their brain suddenly rapidly rotates, you shear pathways, and you mess up the integration between eyes and inner ear and between feedback from muscles and joints and neck and stuff like that. Now you've got all these pathways that are saying different things about where you are in the world. And your brain pours all this energy and effort into trying to make sense out of where you are in space. And it does that by taking secondary pathways and using up their resources, and taking tertiary pathways and using up their resources, because your brain's designed to sacrifice all those higher level functions just to make sure that you don't fall down, right? So if you find yourself in a situation where you're hanging out in a dark room and there's not a lot of sensory stimulus and there's nothing to provoke the mismatches between those systems, you can be pretty chilled and you can think and you can remember and stuff like that. And then you go to a grocery store where suddenly you're just overwhelmed with massive amounts of sensory input, and your head's moving and you're moving down aisles and there's all this visual information blasting past you while you're trying to simultaneously try to hit targets to figure out what it is that you're looking for, and you miss each time. And what happens? You have this massive meltdown. You can't think, you can't regulate your emotions. You have a panic attack in the middle of the store, right? You go back and you hang out in your car and you're like, I'm never doing that again, and stuff like that, right? And the thing that's important to understand is that in many, many situations, so I mean, I don't want to oversimplify what happens with a traumatic brain injury. There's all sorts of different types of TBIs. There's all sorts of different types of concussions. But the one that I just described, where you kind of shear brainstem pathways from rotational forces, that's one of the most common. And it's certainly the one that we see all the time when people have things like car accidents and stuff like that. Those circumstances, it's really common that people feel like, I'll never be able to regulate my emotions again, or I'll never be able to think again. I'll never be able to remember anything. I'll never be able to plan. I'll never have any executive function ever again. And the reality is that when we go and quantify and map out all those pathways, we usually find that the secondary and tertiary stuff is actually working pretty well. It's just being forced to do way too much. You know what I mean? It's like, you think about like an infant learning to walk. Okay. If you watch an infant, when they're first trying to learn to walk, everything they do is like, where do I put my heel? Where do I put my toes? It's all conscious. It's all volitional activity. They're thinking really hard about how to make all this stuff work, right? By the time you're a couple of years old, the only thing that your brain's really doing is saying, let's turn on the walk program, let's turn right, let's stop. And all these lower pathways in your brainstem and cerebellum and stuff like that, they're taking care of all those functions. And that frees up all this space in your frontal lobe to be able to do things like think and walk and talk at the same time, right? Now, when you screw up the lower stuff, all these pathways are going to take over, and because again, they're just going to make sure that you can still walk, that you don't fall down and stuff like that. But anything else that those upper pathways are supposed to be able to do kind of goes out the window, right? So put yourself in a situation where you're trying to walk and you're trying to regulate your emotions at the same time. You have some kind of a stressor. What's going to happen? Your brain's going to go, I don't want to fall down. And it's going to give you a panic attack as a result, because it just won't have the resources to do both of those things at the same time. It doesn't mean that these pathways up here don't work. It usually means that they're just not capable of doing more than one thing at the same time. And what we find all the time is that if we go in and map out what's happening with all those individual pathways and rehab them and get them all saying the same thing again, it's really common that the rest of this function just suddenly starts to express again. And then people get their cognition back and they get their emotional regulation under control. And there were actually some really great studies that were done back in the day about with a bunch of functional neurologists in Texas. They essentially took a bunch of blast injured PTSD vets from Afghanistan, and they put them through exactly the kind of therapy that we do, exactly the kind of therapy that we do at Northwest Functional Neurology, exactly the kind of therapy that any well-trained functional neurologist is going to do. Vestibular therapy, visual integration exercises, all the stuff. And they put those patients up against people that had all the gold standard therapies for PTSD. All right, which basically means they put them up against sertraline, one of the standard medications, and they put them up against cognitive behavioral therapy. And what they found is not only did 2 weeks of functional neurology therapy lead to much better outcomes than any of the gold standards, but the worse the PTSD, the bigger the margin between functional neurology versus everything else, which translates to the worse off you are, kind of the more you need this therapy.
Mm-hmm. Yeah, and you were talking about the secondary pathways and everything, and I kind of equate it to, I use the analogy of like, it's when you have too many tabs open or too many programs open on your laptop and you wonder why nothing will work right. You have to start closing those other programs down before this one can work. And I know for me, I had like, I didn't know it was called startle reflex at the time, but I had a ton of startle reflex. Like if somebody came from the left side of me, it would just like, I would just jump. It would scare me. And like if they came on the right side, it was fine. It was just my left side. And I had a ton of that startle reflex. And and then of course the eyes and everything else going on. But once we started taking care of the eye stuff, then the other stuff slowly all settled down, and I continued doing my exercises. I'd say like 6 to 8 months after my initial treatment, I noticed like I was multitasking again and my memory was working again, and you have to like shut all those other tabs down,
Yeah,
right?
exactly.
To start calming down the system.
There's a if you think about working memory specifically, this is a really great way to sort of
Mm-hmm.
build on exactly what you were just talking about. Working memory is essentially your ability to remember things that happen over the last like 5 minutes or stuff like that.
Yep.
That's what a lot of people inappropriately think is short-term memory.
Right.
Short-term memory is like what happened this morning or yesterday or whatever. Now, working memory, the research has demonstrated that at the best of times, 50% of your working memory capacity is used on visually mapping the environment. All right. Because I mean, if you're going to be able to respond to the environment, you have to remember where the environment is. So everybody is using this fast eye movement called saccades, and you use those to create a visual map of the world, and you're updating that visual map about every 60 to 90 seconds. Now, just imagine what happens if you screw up those saccade pathways, which happens all the time when people have MTBIs, when they get concussed, their ability to hit targets with their eyes goes out the window, and there's usually some aberrancy in their visual map or the speed or how long it takes to start the eye movement or whatever. What winds up happening in those situations is that 50% winds up turning into 60% and then 70% and then 80% as your visual map gets screwed up, and you just have to keep recycling. You have to just keep resampling the world over and over and over again. And you only have so much bandwidth, right? So you wind up finding that you've got less and less and less stuff left over to remember, what your kids' names are, or where you live, or whatever else, right? And you walk out of that thinking, I've got this massive memory deficit. And the reality is just no, your visual memory is creating this problem. Then if we just fix that, then all the rest of the memory stuff generally comes right back.
Hmm. Yeah.
And again, just imagine that every time you try to move your eyes, if you hit the wrong target, what happens? You get stressed. You have that perpetual blast of I just stepped off the curb stress that just makes it easier and easier and easier for you to get to a panic attack threshold. And then suddenly you've got PTSD.
Hmm. Yeah, and I don't think we fully comprehend how interconnected everything is. We take it all for granted. It just works on its own, right? And
Mm-hmm.
then you have an injury, and suddenly everything stops working correctly. And it's such a mystery because we can't see it. And like I said, we've never really learned. I'm talking just like a patient. We've never really learned how that whole system works at all. So it's this big mystery, and the PTSD component of it too. I think a lot of us have like a profound fear of hurting ourselves again.
Mm-hmm.
In that early acute recovery phase, I think we're terrified of. I know I was very aware of my surroundings and what I was doing, and I didn't want to hit my head again. And you add that in with everything else going on, and yeah, it's like a pressure cooker, right? It's just
Sure.
waiting.
Well, how can you not be? I mean, you go from being
Hmm.
fine to having like a completely life-changing experience in a heartbeat, right? I mean, anybody that doesn't get some level of PTSD around that is somebody that's probably just honestly not in tune with what's going on with themselves. I mean,
Right.
some of that's normal, right? But when you get into a situation where you just can't shut it off, and you find yourself in situations where you feel like you're okay in one environment, and then you get into a complicated sensory environment, and suddenly you're not. Those are usually signs that you've got an emotional problem, not based on an emotional problem, but based on an inability to successfully map where you are in the world.
Hmm.
And the thing that's important to understand is that when we talk about not being able to map where you are in the world, I'm not saying consciously. You know you're in the grocery store. You know you're
Right.
standing in the aisle, right? You know you're driving across the bridge or whatever else. But on an unconscious level, all the systems that are telling you where you are in space are saying different things, and that can be super challenging, right?
Hmm.
And then there's another thing that winds up happening, and that there's an aspect of your frontal lobe called the dorsolateral prefrontal cortex that's really heavily involved in all sorts of emotional regulation pathways. When it doesn't fire very well, people tend to have chronic depression and PTSD and chronic anxiety disorders and things like that. And right now, a lot of the research is converging on potentially a DLPFC lesion, a problem with that system being almost like the hallmark of post-concussion syndrome. But from the perspective of if you have post-concussion syndrome, you must have messed up that system to some extent. And they did this thing called the Connectome Project a few years ago, where the technology through functional MRIs has reached the point where now you can not only see what different parts of the brain do, but how they all connect with each other. And they found that the DLPFC was one of the most interconnected parts of the entire brain. And if you think you get shearing forces that, like, rapid twisting things that create problems, well, it's almost inevitable that you're going to mess up some fibers going in or out of that system one way or another if it's enough to create a post-concussion issue, right? And there's some ways that you can diagnose whether or not that system's been affected. You can get there by a specific type of eye movement called an anti-saccade, where when you have a target pop up, this is your ability to suppress looking at the target and instead look in the opposite direction of the target. That's directly a function of that system. And if your anti-saccades are messed up, then that system's not working well. And that puts you in a situation where your threshold for having emotional issues, for having depression, anxiety, panic attacks, PTSD, that threshold gets a lot lower. And then you get into a situation where just normal stimulus is enough to push you over the edge.
Hmm.
So what do you do about that? I mean, certainly doing things like therapy, eye movement exercises that stimulate that pathway can be tremendously effective. There's other therapies that work great. We have a psychiatric nurse practitioner in our office, and you've already spoken with Shauna, who runs a transcranial magnetic stimulation unit. In fact, runs two different TMS units, and that's this FDA-approved therapy that directly stimulates that part of the brain using magnetic impulses, and it lights it up like a Christmas tree. And we've seen PTSD just go from like super high levels to literally becoming 100% resolved in the space of a week or two with a lot of our patients. One of the things that we do all the time with every patient that we see is track outcomes. We do intake and output and outcome questionnaires, and we look at a number of different studies that are well validated in instruments in psychiatry. And all of our PTSD scores, when we look at these things, people always have some very significant improvements. And in many cases, just totally dramatic improvements. And we see that with anxiety and with depression and all the rest of that stuff. And it should be important to understand that we're not doing that with counseling and we're not doing that with medication, although we certainly can and do when that's necessary.
Right.
What I'm saying is, like, we do that based on our therapies. And if our therapies don't fix the problems, that's when it seems like it's necessary to move towards those sorts of therapies and medicines and stuff like that. And we're by no means anti-medicine or anti-therapy or anything like that. We do that all the time when it's necessary.
Yeah.
It's just what we find is that most of the time we just fix the underlying issues, the need for that kind of goes away.
And I think that's the biggest takeaway is a lot of it, you have to get to that root problem, which the PTSD isn't the root. It's the symptom that's out here that you're seeing. We have to get down into the core problem of what is causing it.
Right. And we find all the time that the core problem can be something like a problem with an inner ear pathway. Or if I could just take a random stab at what you talked about, there's the very top part of your brain stem is an area called the midbrain. And the midbrain has got primary relays for light and sound. Your midbrain is where a lot of your visual map of the world lives. And some of those cells in your midbrain respond to light and sound and movement. And if you just think what happens when you don't have frontal lobe modulation of your midbrain, you're basically become like a visual slave to the environment. We all have these reflexes where something enters the visual field and we go like that, right? You quickly automatically shift away from it. Your eyes kick towards the target, you get unstable, and you fire this huge stress response. And what's that from? That's from evolution. That's everybody talks about reptilian brain. That's literally squirrel brain. You know what I mean?
Yep.
And find a more stressed out creature than a squirrel, right? But there's a reason that those
So
reflexes
true.
exist, because they promote survivability. They keep the squirrel one step ahead of everything else, right? So we all have those reflexes, and our frontal lobe is supposed to help us regulate those reflexes. And if you mess up some of those pathways, especially if you only mess them up on one side, well, then all of a sudden you're in a situation where something enters your visual field from one direction and you freak, and then something enters from the other side and you're fine, right? And what do you do about that? You rehab the pathways that modulate those systems.
Mhm.
But if you don't understand that that's the game, if you don't understand that that's the problem, then what are you going to do? You're going to start doing things like benzodiazepine medications, which create more problems than they solve, or you'll go on antidepressants, or you'll spend a whole bunch of time in therapy. And I'm not saying that any of those approaches are the wrong approach, but they're symptomatic control. You
Mhm.
know, they're chasing a consequence rather than a cause.
Yeah.
And what's the cause? Well, in that case, it's about that midbrain tectospinal reflex that's out of control. And so what do you have to do? You have to be able to map all that stuff out. And that's where, honestly, the functional neurology profession comes in, because that's what we do. And by we, I don't mean Northwest Functional Neurology. I mean, that's what anybody that's well trained in functional neurology that's practicing in this game does, right? So you go and see somebody that understands this. The first thing they're going to do is give you a huge physical examination, and they're going to look at your sensory systems and your autonomic systems and your motor systems and your cognitive systems and all that kind of stuff. And they're going to map out and quantify precisely which parts of your system are working and which ones are struggling to keep up. And they're going to use that information to help you build a rehab protocol that's designed to get the systems that aren't keeping up back up to speed again, to get all those different maps of your visual system, your vestibular system, and everything else, your eyes, your inner ear, saying the same thing again. So you can figure out where you are in the world again, so you can respond to it appropriately. And if you take that stress out of your system, which honestly is pretty much the primary issue when somebody has a brain injury, right? When somebody has a traumatic brain injury, when they get post-concussion syndrome, it's not a visual problem. It's not an inner ear problem. It's not a neck problem. It's a problem with the way that all those systems talk to each other.
Yep.
And if you can get all those things back on the same page, then it's almost inevitable that all the rest of the cognitive and emotional regulation stuff improves dramatically. And a lot of people think that, that's something that requires really specialized technology. And certainly it's easier if you got all the fun toys. I mean, there's a reason why we've got this massive vestibular lab and all, hundreds of thousands of dollars worth of equipment in our practice and stuff like that. But it's not necessary. The thing that's necessary is just an understanding and an ability to observe. Some of the most talented functional neurologists that I've ever seen in my life can walk up to a patient and just do this a couple of times, look at a head tilt and go like that and do this, and then go, here's your problem, and fix it in real time.
Yeah.
Right. And that's something that I think is really important to understand, because when somebody's had a traumatic brain injury, I mean, we see patients all the time that I mean, just last week I saw somebody who went twice to a practice in Texas and then called me up and said, I didn't know you guys were here. And yet the people in Texas are people that I know pretty well, right? And this guy had like been flying back and forth for like 3 years trying to get his brain injury fixed, and he lived like 3 blocks from us,
Wow.
right? And that's happened more times than I can count, honestly. What I tell everybody is the best functional neurologist for you is honestly just going to be the closest one, as long as they're well trained. It doesn't matter about who's got the best toys, or who's got the biggest TMS or rotational chair device or anything along those lines. It's just, you got to find somebody that understands what they're talking about, and that their heart's in it, right? Because I mean, the vast majority of people that get into this profession get there because they have this massive personal drive and compassion. They put themselves through crazy amounts of stress and effort and energy to get to the point where they can do this stuff. Not because they thought it was a great idea, but because they felt like they just didn't have any choice, right? And certainly that's my story, and that's the story of everybody that I know that I trust and respect that's in this profession. And there's a whole lot of those people out there. So if there's anything I can say to a patient, I mean, it's like, first of all, don't give up hope, right? Because the people that give up hope are the people that stop getting better, inevitably. And then second, anybody that's well trained as a functional neurologist that's actually practicing doing TBI work. And it's important to understand that not everybody does. There are some people that are just about things like sports performance or things along those lines. Mm-hmm. But if they're holding themselves out as somebody that's trained in TBI, then they're going to do as good a job. I don't want to say necessarily as good a job, but they're going to do a great job. And I can guarantee that they're going to do a better job than anybody else that you've seen that doesn't have this training. Yeah. All right. So what's the best functional neurologist for you? It's the guy that's down the street if he's properly trained, right? You don't have to fly all over the world. I mean, I saw a patient last week. Well, fair enough. But I mean, like I saw somebody last week who came to see me from Manhattan, who had been to Switzerland and had been to the Netherlands and had been to San Francisco, and just like all this stuff just bouncing all over the place. And I was like, well, you're here, and I wish I'd known this story before you came out, because I would have sent you to the guy down the street that I know that's like 3 blocks from where you live, who's great, And then she was like, oh, okay, well, fair enough. Well, I guess I'm here. Let's fix it. And so we did. But even so, but I set her up with follow-up care with somebody that's really close, who can do a fantastic job and certainly could have done everything that I did. Right.
Well, and this, functional neurology, I mean, anyone who's followed me knows that that's where my heart is, because that's what helped me. And, I didn't know about it, right? It was just by chance that I stumbled upon it 2.5 years into my recovery. And that's why I'm so passionate about bringing this series to people and bringing the book to people, to help them find you guys sooner in their journey. And, in some cases you might be too fresh in your injury, right? Like you might need to wait a little bit before you get into an intensive treatment. But, I want you to have that option and to know that it's there and available. And there's amazing doctors like Dr. Zielinski who can help you. So thank you for being here today. This was a really great conversation, and I think it helped kind of clear that up for people of how all those different systems in our brains, all those computer tabs on at the same time, that's what's happening inside our heads. And if we can get them to start shutting down, we can get functioning at a higher level again. So thank you for being here and sharing that.
Well, it's always great seeing you again, Amy, and I appreciate the opportunity. All right, thanks.
Anyone that wants to find you, we have all your contact information below the video. And your website is northwestfunctionalneurology.com. They can find you on Instagram at Northwest Functional Neurology. And if they're interested in learning even more and seeing if they would like to work with you, they can always reach out to schedule a consultation, correct?
Absolutely.
Thanks for watching. I hope you enjoyed today's video. Be sure to hit that subscribe button so you don't miss any videos in this series. Like this video and head to Amazon to purchase Concussion Discussions.